intensive care nurse, and I've been an intensive care nurse for just shy of 4 years now. Intensive care, so I've worked there just about 3.5 years, I'd say. So my day-to-day is looking after people who need organ support, so whether they need a breathing machine such as a ventilator, they need blood pressure medications because their blood pressure's in their boots and they need something to push that along. I look after people who either come back from theatre and they're really sick, have a traumatic event, either a car accident, a cardiac arrest outside of hospital. Basically anyone who has had an event that leads up to something that needs supporting, so that's either their breathing, their respiratory, so breathing, their kidneys, and things like that. So when I first qualified, I worked on a respiratory ward, so we looked after people who needed the non-invasive ventilation, so that's when you have a mask. So we think of ventilation as invasive, so that's the breathing tube down your mouth and into your lungs, or non-invasive, so it's like apparatus on top of your face then. So I worked there for about 18 months after qualifying. It was I loved it. I loved because I worked in Wales, so I got all the Welsh miners with all the nasty chests, and you know, they all knew each other from some way or another, but I think that's Wales as well. So I just wanted a bit more of a challenge, and with intensive care nursing, you know, you might have just 1 or 2 patients, but you cannot leave that bed space because you've got parameters that you've got, like if you're on a cardiac medication and you've got to set the parameters to a certain blood pressure, which is sustainable for life. As dramatic as that sounds, that's what your job is. I saw a job pop up in quite a well-established hospital, which was miles away from where I was based, and I thought I would just go for it, because the worst thing in life I thought was I never want to have that regret. If I applied for something, didn't get it, then I've tried. If I saw it, missed it, I didn't want to have that regret, so I thought I'll try. So I made the journey down, had a tour of the intensive care unit, saw loads of machines, loads of monitoring, thinking, oh, I'm not sure this is for me. But then I thought, oh yes, I want this. After I saw that unit and saw the nurses and just having chit chats with people, I was like, yes, that's what I want to do. So from the age of 14 to 18, I worked on a Saturday job as a waitress. I worked in an afternoon tea shop. I made cakes in the morning. I helped waitress in the afternoon, and I loved it because, and then when I went for my interview for nursing, they said, you know, there's so many like skills you get from that. So dealing with the public, you know, if Mr. Man isn't very happy that his vegetables are cold, it's how you deal with that, and you know, it's getting the social skills that you gain from dealing with people. But it's also working as a team, and you know, even as though I was the youngest there, it's being counted on, and you turn up, you're presentable, and it was a really good start for me. And I think it's so important that, you know, looking back at the time when I was 16, trying to get out to, you know, thinking, oh my God, Saturday, it really encouraged me to push myself. So I work a combination of days and nights. I work 50% days, 50% nights, and that's just my rota. You can request to an extent of what you can work. What we would do, we get a handover, we get our safety briefing, which is like, what's the important things, like are there any drugs that are going to expire, who's most at risk on the unit, and then we get our bedside handovers. So typically you get between 1 and 2 patients, but that depends on how sick they are. So after my handover, I would start assessing my patients. So that's literally going from, you know, what's their airway, what's their breathing, what's their breathing pattern, and I listen to their chest with a stethoscope, I take their blood pressure, I could go through it all, but it's going to bore you to tears, but it's me having a proper top to toe examination of my patient, looking at what medications they're on. Intensive care patients are like smouldering volcanoes, because you never know when they're just going to go off. And no matter what you do, even if you know they're hooked up to the nines, we're looking at their blood pressure all the time, we're looking at the rate their heart's beating. but something could happen and something could just trigger it, whether they have a seizure or they start their, plugging off on the ventilator. We need to do some physio with them. And it can be really tricky, because then you've got your relatives who come in, and obviously they're scared out of their wits, because no one wants to be in hospital. It's a terrifying experience, and maybe as ITU nurses we become so accustomed to seeing on life support every day, you sort of have to think, crikey, what if that was my mum in the bed? How am I gonna cope? You've got to look after your patient, but you've got to look after the family, because we've had a patient in recently and I looked after him, but when he was asleep on the ventilator, but I knew his mum, I knew his dad, I knew his wife, I knew his kids, and then when he woke up, he didn't know me, but all his family, oh, that's Hannah, she's looked after you loads. And because you feel like you know them, but they're like, nope, no idea who you are, because we keep them asleep, because that's the safest way for us to be able to look after them, is to take over their breathing completely. Sometimes they don't have to be sedated, they can breathe on the ventilator. If your patient is on a ventilator or they're on this specific monitoring, blood pressure monitoring, you don't feel you can leave that bed space. And even though your colleagues, they might all be looking after someone as sick as your patient, or they might be looking after someone sicker. So you do have breaks, obviously with breaks, because that's the legal requirement to have breaks. You don't have like a lunch hour. So on day shifts it's easier because you have like a lunch break, then you have your tea break in the afternoon. But on nights, we're a different breed on nights, because you all fancy curry and chips at 7 o'clock in the morning when you come home from work, or you're like, you don't drink enough and then you're going to bed. So I find that really bizarre. So when my boyfriend's going to work and I want to eat a proper dinner at 8 in the morning, he's like, what are you doing? But then like before I go to work, I'm like, I just want cereal. I think you've got to appreciate that ITU, it is a people on life support. It doesn't always go well. Like people don't always make it through the intensive care stay, and you can work tirelessly to make them better, but if they can't always get better. And I think that's when you need your colleagues to be, would you have done anything different? Could I have done anything different? And that's tough, because you always second guess yourself, even if you couldn't have done anything. There's always that, but what if? And that's hard. I've had some really tough shifts in ITU. So when I first started, I looked after someone the same age as me who died, and that was really harrowing. I find that really tough. And also like other things which you think of that might happen to me in later life. I've looked after ladies who've had stillborn children, and it's like times like that where the mother was really septic and they just wanted someone to talk to, and it's just tough. You see people at their worst times and you see the family having to deal with that. Like, I really need my colleagues. I've got some really excellent people in my life. And I think it just makes you appreciate, not to sound cheesy, but it makes you appreciate life that bit more. So, you do hug everyone a bit tighter, you do tell everyone you love them, because life's short. Life can be really short and really tough. And I think it's appreciating that not everyone's like this, not every day is going to be like this. And some days you can really turn a patient, to them right round. You can do a UE, because you've had them when they were really sick, and little bits throughout your shift, they've got better. Not some people will just be sick all the time, and it might take them a few days until they see any signs of improvement. And you just got to take the good when the going's good. Yeah, it's seeing people get better. So when we've had someone recently who's been so sick, and he was intubated on a breathing tube, then he had a tracheostomy, and he was on all the blood pressure support, and then the blood pressure support came down, the tracheostomy turned into just the trachea, he didn't need the ventilator, so they took the trachea out, and now this week he's starting to walk and he's starting to talk, and he's got his sense of humour back, which is always a given. I love that. And you can just be like, yes, you're doing it. And we do in ITU we do follow-up clinics, so after people have been really sick, about 6 months later we see them again in clinic, which I've done actually, and you know, they remember the weirdest things. Like some people think like the mask they were a pilot or they were on a boat because they're on air mattresses, so it sort of rocks them a little, not this dramatically, but it just ever so slightly, it turns them a little bit, and you know, it's their way of their coping mechanisms of how I got better. And that was amazing to see. There was one lady who was so sick, and I remember because she had these, she had a reaction and she had all these blisters on her legs, and I remember spending hours dressing, redressing because they were so sore. And she just said, I remember everyone just taking such great care of my legs. And you know, when you think, yes, that was me, I did that, and you're better, and this is amazing. So there's 4 different types of nursing, and there was adult nursing, children's nursing, mental health and learning disability. So I went into adult nursing because that's what I was most interested in. And then I went on to the respiratory ward for 18 months, then I went into ITU. So since working in ITU, I've been doing my master's modules, so I've been working towards a master's, and I still am. Oh, it'll be fine. So you can specialise into those 4 main categories, and then you can go into anything you want. But so like if you think there's like hospital nursing or there's community nursing, but I was more interested in hospital nursing. So my training was 3 years, so it's all degree. I think they're trying to change. They've got like associate nurses now, which they've started in our hospital. So I'm not sure about the ins and outs, but I think it's like a 4-year program and they can work. They're talking about introducing associate nurses into ITU to look after like our lower level care patients. So the patients who are on the rehab pathway, who might have been really sick. So these are the ones who are getting better, who don't have the trachea in, and they are just, because whilst in ITU you get muscle weakness and you need to sort of regenerate yourself back up. Yeah, so there's different courses you can do, and you can sort of top up and specialise into whatever you're interested in. So I've done an ITU course, and then I'm doing more clinical assessment things because, like I've said before, you don't want to regret. And I started doing some modules, and I thought, oh, we'll see how this goes. And I've got so far, I'm like, well, I might as well do the whole thing now. So it might not be, the masters I'm doing might not be where I want to end up, but why not? Keep going. So when I was doing my A-levels, I really didn't know what to do. So at my AS levels, I did 5. So I did, what did I do? I did geography, history, law, biology and English literature. So all the humanities, because I had no idea what to do, and I did what I enjoyed. So when I got to A-level, I decided that was a bit too much. And so I carried on doing law, English literature and biology, which doesn't scream nursing. I really wasn't sure. I wanted to do law originally, hence the law A-level. And I did, there was like a taster session in Cambridge for like a week. I'm not Cambridge level, but I just thought, well, it's good because, you've got to try these things, see what it's like. If it's not for you, it's not for you. So I did it, was not me. And so I literally was flicking through a prospectus and I was like, I don't know what to do because I need to do something that I'm going to have a job at the end of. That was my important thing. I just didn't want to go to uni to go to uni. I wanted to have something where I've got a qualification after. So health sort of stuck out for me, which was really not where I thought I'd end up. So with nursing, what was the most interesting for me was that after you did your 3-year degree, you got your NMC registration. So that's the Nursing and Midwifery Council registration. So you got your PIN number, and that was a good basis because if I didn't want to work here in the UK, I could work, you can work anywhere really. So I think it's important to focus that you've got transferable skills. So I know it's ideal to have experience in the healthcare setting, but you could work at McDonald's and you still have the qualities that you're in a team, your communication is fluid, you're focused on getting that end product. A burger patient, same thing, because you're still working towards a common goal. Cool, you've all got transferable skills, don't be put off. I remember thinking when I was 18 that looking at my cohort, I was still one of the youngest there, because they were all either married with children, the people who I was with, and you know, it's great because in nursing you're never going to expect to work with you're never going to work with people your own age, because that's the nature of nursing, that everyone from different aspects of life and maybe different places in the world all come together. Interesting. I did some interviews actually for nursing at a university, and that was really interesting. And I think it's preparing yourself for that interview, saying, if I was really sick, excuse me, if I was really sick, what nurse would I want looking after me? And it's saying what you would want, what nurse you want to be. And I think that stumped a lot of people when I was doing the interview, saying, well, what do you want? Who do you want to be? Who do you want to look after you? I would want someone who would talk to me honestly about what's going on. Even if they want to tell me what's going on EastEnders, that's fine. Just sometimes when you're really sick, you don't want to talk about what's going on. You want to talk about what's going on outside. But I think it's important that to have some work experience when you can. So even if you spend half the morning at a solicitor's, or spend half the morning in an area you're interested in, you know, it's just showing that willing that you want to go and have. Important skills is communication, being open and honest, because no one wants anything sugar-coated. When you're really sick, you want to know you're really sick, because I don't think sometimes people appreciate that they've been in ITU, and how sick they could have been or can be. Being personable, being friendly and approachable, because no one wants someone who's grumpy. And I think it's really important to have that professionalism at leaving. You know, there's an element of leaving things at the front door of your house, because no matter what's going on at home, although it affects us all, you need to come to work with that fresh face, thinking, what's my priorities today? And you've got the 6 C's, which are important if you're going to nursing interview, to look them up. I'm not going to tell you them because you can look them up. So it's showing compassion and being empathetic and appreciating what a hospital stay is. So we have an allied health professional team. So on a day-to-day, I talk with dietitians, speech and language therapists and physiotherapists. We do a mini handover before the ward round, just to highlight which patients we are concerned about or need input from. I talk with pharmacists, because we have so many drugs in ITU, and we have quite strong and powerful drugs in ITU. I talk with doctors, obviously, they do show up. So doctors, consultants, and doctors from different areas of the hospital. So when you go into hospital, you tend to either be medical or surgical. So you have different teams within those areas to come and review your patient. We also, as I said about physio, but they're so important in ITU. They do a lot of chest physio, a lot of rehab. We have occupational therapists. We have the microbiologists who come around to assess the amount of antibiotics they're on, if there's any samples or blood tests that need to be sent. Who else? We have a multitude of people who, you know, porters, we have housekeepers, porters, who are so important, because the whole system wouldn't run without everyone involved. Family. From being a staff nurse on a ward, you can become a sister. Within our remit, you can become an advanced nurse practitioner, which is a role that I think I'd be interested in going into, and that's someone who's got advanced assessments, who can intubate, who can put in arterial catheters, central line catheters, and that's a really, for me, that's a really interesting part. You can become a senior sister, you can become matron, head of nursing, director of nursing. You know, you can go up and up and up, or you can, you know, it depends how ambitious you are, because you can become a really good nurse who's been in cardiology, respiratory. You've got so much experience, you know, you can do whatever you fancy. You can become a dialysis nurse. It's so varied. How long night shifts were. My goodness. Like, I think I would be amazing at a rave right now, because I can not even need coffee anymore for 12 hours. I think the shift pattern can be quite erratic. I don't think I appreciated how much you need your colleagues, and how much they need you, because you see them every day when you're in work, because we don't get weekends, and like we've got a weekend, we're planning a weekend off on a Tuesday to a Wednesday. I think I didn't appreciate how much nursing would change me as a person. I think it's made me appreciate life a lot more, and how short life can be. And I think you've got to do something you really enjoy. But it's such a hard time, because you don't know what you enjoy or what your strengths are. But I think from my Saturday job, that's what made me think I want to work with people. And never put yourself down. You know, you can achieve what you want to achieve if you put your mind to it, and it's only you who will stop you. Oh.